Okay.
I know what that is.
Alright, so now I'm going to do an eye exam.
Okay.
I'm going to check your visual fields to make sure that everything is okay. I'm going to do like it's called confrontation.
Mhm.
I'm going to have you place your hand over your eye, and I'm going to put my hand over
The opposite eye.
right.
Uh-huh.
And then I'm going to have you look at the point,
Okay.
and I want you to follow it. Okay, now we're going to do it on the other side.
Okay.
Same thing. Okay. I'm going to inspect just to make sure that everything looks okay just externally.
Mhm.
Everything seems to be even. Really, it appears as if you have a slight, like your left eye is just slightly bigger and brighter a little bit. And then I'm just going to do this. I just want to check your reflex. It's equal and reactive to light. Everything looks good there. Your brows seem to be symmetrical. You have eyelashes are present. You know, I'm going to inspect your sclera and your conjunctiva, and everything seems to be, your conjunctiva seems to be clear. Your sclera is white. Everything seems to be all intact. Your iris is appropriately intact. I'm going to, and I already checked to see if you accommodate, they converge when they move and constrict. And that's normal. And then I'm going to do an ophthalmoscope exam. And I know it's going to be really uncomfortable and bright. Everything, I can see the red reflex, you have no hemorrhages, everything looks appropriate in that side. All your landmarks seem to be. Same thing, everything looks good, everything converges the way it should. I'm going to do just basically a whisper test.
Okay.
And I'll have you repeat it. Can you hear that?
Yes.
Okay, that's appropriate. Your ears appear to be aligned appropriately. And they're equal. I'm going to do an otoscope exam. I'm going to step over here. And your TM, you have just a slight amount of cerumen. Your TM, tympanic membrane, looks good. You do have a little bit of just discoloration. Appears to be like a childhood scarring for maybe some otitis.
Okay.
Same thing, sorry. I know it's uncomfortable. And this ear looks clear. The external canal looks clear in both ears bilaterally. I didn't notice anything to be abnormal there. I'm going to have you tilt your head. I'm going to basically just look in your nares and make sure I don't see any drainage. Everything, it looks clean there. I'm going to can have you close one side and take a breath, and is it by any way congested? Do the other side. They seem to be clear bilaterally, so they're patent, no signs of any problems. I'm going to have you see if you can smell. Okay, what is that?
Smells like vanilla.
Okay, that's accurate. And then we'll do a further assessment.
Okay.